I'd like to thank you all for watching this video and taking the time to understand the needs of some of the people in the local community here. There are many other people like this man who, if they were living in other countries like the UK where I live, you could go to a government facility, get treated for free, or in other countries get treated at an affordable price. But here and in many African countries, services are still lacking and being developed, and there is a real economic impact when a person cannot see. I think it's very difficult, it must be very difficult for this man to not be able to work and not be able to earn a living. I would hate if that would happen to me, and I really hope that this man gets the help he needs, and that others do too. And I know that many people, many of you watching have already helped, and thank you very much indeed. Thank you so much. And I hope you continue to watch and keep up with what you're doing, because the project, some of the projects I've been visiting are really extraordinary. Thank you, Ambrose.
Yes, hello everyone, you are welcome again to this video, and I'm very super excited to have you again in this video. Yes, we are always delivering eye care. This man is having a problem. He has bilateral cataract, and in this month of June we are doing what we call cataract awareness. We want more people to get cataract surgeries. We want more blind people to be diagnosed, and so that we can be able to dispel all the preventable blindness. Mzee, wakama sina holanga bana.
Wangati. Wangati.
Wangati. Simo na amale mukasi nange sibona bulait.
Ari n'imyaka
kirano. Reka kabire na zimba nitsinge sibona bulait.
Zimba nitsi khuzo khabe olingenda ulumbuchi lwa mambe murwe. Ari ngarwa mambire murwe chakero cha maliako.
Wanywera khona mwenga swanywera khona.
Ngase nanywera khona.
Ngase wanywera khona nenga ulumbuchi lwe.
Ari yole mbuka basi niyo khumchimuna khutanda khumalia. Ari bengenda ngane khangile ndi imbono khawo awo basi noyo lile mbuka chafu.
Saraka hali nenga abetsitsambolambola. Mr. Wangati, his sight has been deteriorating slowly. But he started having visual challenges 5 years ago. Now he has lasted 5 years, but it started slowly as he's doing things, but it becomes more dim and more dim up to now. Nengetsimalia tsiriyo utsaho musauna mwewe chanja bila malala sine.
Sinajaho musauta khulija khuicengolobe makali na khulwe makali.
Okay. So he has been having dim vision, but he has not ever looked for an eye health worker until he came recent in the facility and is being identified with bilateral cataract. So I think each of us in our media platforms, we can be an agent for change, like for many people to come out and have cataract surgeries. So if you Lipes
ni elia hai na ruma na ngeze ata ukhabolera busa munju takhoni ne magali kila khwechile khuli.
Okay, so his greatest fear is the cost of the surgery, but he's free to have a cataract surgery. So I think we can be elements of or agents of change, and we work on the barriers that limit cataract surgery. And hopefully our facility is soon starting cataract surgeries so that we can offer it at a cheapest price, so that cost friendly and cost sharing with the patients, so that we can be able to dispel the preventable blindness. So I think we have checked on him, and hopefully we shall be working hand in hand with the family as we are going ahead there, so that when we get opportunities. We have already consumables from one of our partnering organization, that's Charity Vision. And when we get funds for human resource, we shall have another surgical camp so that we can be able to have more cataract surgeries done in our community. So, sineshenesu missing nga hubona. Holo huba so hubona bulait. Ulimbanga hubona andisa na holendi sineshenesu.
Joniba jana mbobona andi na hola sino ifuna holipe.
Ngani sombola ko sasituela shenesu so hola no afuna lipe.
Abanga besebe ni mareja ne ifuna. Haraho jaho ambe mbako simanye ni maena tu.
Okay. He says that what he misses most because of sight is doing his work and doing some small work for people so that he can be paid and get some money. So he's not able to see to go and do all that. Okay. Him benefit from a cataract surgery so that he can go back to do his work. And we are going to arrange that so that we can be able to have a cataract surgery. It may take us some weeks, but when we get resources, we shall be able to have a cataract surgical camp in the community so that we can have more people like him benefit from a cataract surgery. So thank you very much for all of you who have seen some of our activities, and we're looking forward to having you. And if you're watching us for the first time, please consider to subscribe because why you subscribe is that it is one of the ways of promoting eye care in the remote served communities. Like I always say, in Namisindo district is one of the districts with over 257,364 people, but there was no eye care. That's why we came in and we had to give eye care to the grassroots. So thank you very much.